Hey there, health enthusiasts! Today I'm diving into a pressing topic that's got the global health community on edge: Mpox. You might be asking, is Mpox the next global health crisis? Well, let's break it down. Mpox is a viral infection that spreads through close contact. It causes flu-like symptoms and lesions filled with pus. Usually it's mild, but don't be fooled, it can be fatal. The World Health Organization recently declared Mpox a global public health emergency. This follows an outbreak in the Democratic Republic of Congo, which has now spread to neighboring countries. Alarm bells are ringing because the latest strain of the virus could be more fast-spreading and deadly than the early 2022 outbreak. Dr. Hans Kluge, the WHO's director for Europe, assures us that Mpox is not the new COVID. He believes it can be stopped with international cooperation, but health experts have flagged many unknowns about this outbreak, making it tricky to contain. Let's talk about the specifics. There are two main types of Mpox, known as clades. The latest outbreak is identified as clade 1, which, compared to the 2022 clade 2, spreads more easily and has a higher fatality rate. Particularly concerning is a new subvariant, clade 1b. Professor Trudy Lang from the University of Oxford points out that this subvariant might spread more commonly from person to person, and even from mothers to their babies during pregnancy. Jonas Albarnaz, a research fellow at the Purbright Institute, highlights that clade 1b is notably prevalent among young people and appears to be spreading through sexual networks. But more data is needed to understand its transmission dynamics and inform control strategies. The situation is especially dire in vulnerable regions. Clade 1 is known for causing severe disease in young children, pregnant women, and immunocompromised individuals. Countries with poor healthcare systems and higher HIV prevalence are particularly at risk. Ongoing conflicts in parts of Africa, like the DRC, are worsening sanitation conditions and accelerating the spread. So far this year, the DRC has reported over 15,000 cases and at least 537 deaths due to Mpox, and experts warn that more cases are likely to emerge. Brian Ferguson, an associate professor of immunology at the University of Cambridge, criticizes the lack of activity between the prior outbreak and now. He stresses that there should have been more effort to produce and distribute vaccines. Speaking of vaccines, Danish biotech firm Bavarian Nordic, one of the only companies with an approved Mpox vaccine, is considering ramping up production. CEO Paul Chaplin mentioned that extending the use of their vaccine to adolescents is crucial, given that more than 70% of the cases in Africa are in people younger than 18. So, what's the takeaway? While Mpox isn't the new COVID, it's a significant threat that requires prompt action and international cooperation. Stay informed, stay safe, and let's hope the global health community can contain this outbreak before it gets out of control. Thanks for tuning in. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell for more updates. Stay healthy, everyone.